Hello and welcome to Medical Dialogues. I'm Dr. Gadma Soni. Let's look at today's top medical news. Danish study finds air pollution impacts male fertility and traffic noise with female infertility. A Danish study published in the BMJ has revealed that long-term exposure to fine particulate matter, air pollution, is linked to a higher risk of infertility in men, whereas road traffic noise is linked to a higher risk of infertility in women over 35. Infertility is a major global health problem affecting 1 in 7 couples trying to conceive. Several studies have found negative link between particulate air pollution and sperm quality and success after fertility treatment, but results on fecundability are inconsistent, and no studies have investigated the effects of transport noise on infertility in men and women. To address this uncertainty, researchers set out to investigate if long-term exposure to road traffic noise and fine particulate matter air pollution was associated with a higher risk of infertility in men and women. Noise was not associated with infertility among younger women. Clinical trial finds adding certain anticoagulant drug ineffective for stroke patients. Stroke patients who survive a blood clot in the brain's blood vessel are prone to developing new blockages during their recovery periods, even if they receive vessel clearing interventions. In an effort to avoid further clots, doctors at 57 sites tested a possible solution: the addition of anticoagulant drugs to medicine that dissolves blood clots. But results from the clinical trial led by the Opiolu Adoy, MD, head of Department of Emergency Medicine at Washington University School of Medicine in St. Louis, indicate 2 such drugs did not improve outcomes. The findings are published in the New England Journal of Medicine. "We are a little disappointed in the results," said Adoy, who is also the BJC Healthcare Distinguished Professor of Emergency Medicine. "But it's meaningful to optimal patient care that we have answered the question definitely. Neither of the drugs help prevent further clots." The goal of the multi-arm optimization of stroke thrombolysis clinical trial that Adoy led was to test the efficacy of adding argatroban, a blood thinner, or epifebitide, which inhibits blood platelets from sticking together, to the routine intravenous thrombolysis treatment. The trial closed the chapter on this potential use of these medications, but Peter Panagos, professor of emergency medicine and co-author on the study, said that efforts like this inform future advances in medicine, including potential new anticoagulant treatments. Insulin and Metformin shows promise in treatment of diabetic foot ulcer, research finds. Researchers from Michigan State University and South Shore Hospital in Massachusetts have uncovered a connection between 2 common diabetes drugs, injectable insulin and metformin, identified in wound exudates of diabetic foot ulcers, which may improve their healing. Research published in ACS Pharmacology Translational Science has found that wound exudate, the fluid the body sends to an injury site, contains metformin in patients who take the medication orally. The researchers then explored metformin's relationship to insulin. They found that patients who take both insulin injections and oral metformin, the amount of metformin found in wounds significantly increases. Study finds heavy metal cadmium may link to memory issue. The heavy metal cadmium, which is found in the air, water, food, and soil, is known to cause health problems. A new study published in Neurology examined if thinking and memory skills were associated with cadmium exposure. They found no association when they looked at the group as a whole. However, when looking at black and white people separately, it found cadmium may be tied to problems with thinking and memory skills in white people. The study found no such association in black people. This study does not prove the cadmium causes memory problems in white people. It only shows an association. Cadmium is a highly toxic heavy metal that enters the body mainly through cigarette smoking, breathing, polluted air, and food. It is released into the environment through industrial and agricultural activities. The study involved 2,172 people with an average age of 64 and no problems with thinking and memory skills. New published guidelines for Helicobacter pylori suggest change to treatment recommendations. The American Journal of Gastroenterology has published a new guideline on the treatment of Helicobacter pylori infection. H. pylori is a bacterium that infects over half of the people in the world, though most are asymptomatic. It can cause dyspepsia, peptic ulcer disease, and gastric cancer. Previous guideline was published in 2017. It had maintained the recommendations of a proton pump inhibitor, clarithromycin triple therapy, as the primary treatment option option. In the new guideline, number 1 recommendation for treatment naive patients is bismuth quadruple therapy. That treatment typically includes a PPI, tetracycline, bismuth, and a nitroimidazole for 14 days. We were already recommending that healthcare providers move away from PPI triple therapy in 2017 because of increasing problem with chloromycetin resistance amongst H. pylori strain in the United States. Corresponding author of the guideline, William D. Chase, said. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.